So, Nahid, the CQC released their latest report on monitoring the Mental Health Act, and once again that's kind of thrown light on some of the racial inequalities experienced by people accessing mental health services, which places added focus onto the importance of the Patient-Carer Race Equality Framework, or PCREF.
Yeah.
Maybe if you could just kind of take it back to the beginning for us and talk about what is PCREF, why was it introduced?
Yeah, sure. The Patient and Carer Race Equality Framework, PCREF, is a national anti-racist framework in England that all mental health trusts must implement by 2025. The ambition and the aim of this framework is to introduce and implement measures that will improve access, outcomes and experience for racialised communities. And it's these racialised communities who are experiencing disproportionate outcomes and experiences in their mental health services. And that's what you're referring to in terms of the CQC report that's highlighting some of the stark statistics.
Yeah, absolutely. So can you tell me a little bit more about the framework you mentioned?
This framework will become also part of CQC inspections. So it's mandatory. It's not a choice. It will be a legislative legal requirement in terms of inspections, in terms of how a trust performs. So all NHS mental health trusts will be expected to demonstrate an action plan that is focused on three key areas. They're around, first one, leadership and governance. And this is making sure that organisations are held accountable to embed race equality in their policies and what they do in the future and in terms of the culture of the organisation. The second key area is around data and performance monitoring. Now, we know data is gold, how important it is, but when you haven't got a data collection that's robust enough around racialised communities, we're not going to be able to measure disparities, track them. We're not going to be able to measure or evaluate how good or bad a service is, and even see performance is going, and also introduce targeted interventions. So robust data collection, analytics is crucial to this PCREF framework.
Yeah, of course.
And the third area is around patient and carer voice. Of course, the PCREF is about the patients and carers, and it's for them as well as the organisations. So one of the ways that you can make sure that we're serving the communities and ensuring we have services that meet their needs and are culturally competent is to ensure that they're involved in co-design. It's no longer about taking a service to the community, and expecting communities to adapt to what we created, being the NHS Trust. This is about co-production, co-development, and bringing racialised communities into the mix at the table and designing and shaping those services so it meets their needs.
So moving away from that old kind of narrative around hard to reach communities and actually designing services that meet the needs of those communities.
Absolutely. And how better to know how to meet the needs of communities, but to ask the communities. And we learned this in abundance during COVID-19, where we again saw similar disproportionate impact of the virus itself in terms of outcomes, experience. I mean, all the things we're talking about in terms of mental health right now, right? So it's just another area where we're seeing exacerbated inequalities. So the PCREF is here to put a handle over this and have an accountable element. So those are the three areas, but woven within those three areas of leadership and governance, data, and patient and carer voice are organisational competencies. And these are essential competencies that will ensure that the workforce is trained well. You can't have an organisation that's culturally competent if the workforce aren't trained in how to deliver it, and policies aren't developed in line with that. So these organisational competencies are also a crucial part woven throughout the PCREF framework.